Hello, this is Team STK, presenting to you how racial discrimination can affect healthcare delivery systems. Mr. Bill saw Violet walking into class today, seeming very upset and sad about something. He asked Violet what had happened and found out that Violet was racially discriminated against in the healthcare delivery system for her ethnicity of being Asian. Mr. Bill comforted her and sat down to explain to Violet about what she had experienced. Mr. Bill explained, according to the International Encyclopedia of Public Health, a healthcare delivery system is the organized response of society to the health problems of its population. Then, Violet wondered about racial discrimination. Mr. Bill replied, according to the Equality and Human Rights Commission, racial discrimination is when you are treated differently and harmed by that treatment due to your race. There are many people in the world suffering from experiences such as Violet before, some with more serious implications, others with more minor ones. A survey conducted by the STK team reaching out to people in 17 countries from 4 different continents showed that 30.4% of them are being or have been discriminated in the healthcare environment, while the other 69.6% have not experienced racial discrimination yet. When this is scaled up to the current world population, there are roughly 2 billion people who have been discriminated against in their lifetime at varying severities. Mr. Bill then went on to explain common reasons for the racial discrimination, which includes, firstly, communication barriers are there due to the patient and the doctor not sharing a form of common language. Healthcare centers which do not have translators for minorities who cannot speak the native language have issues communicating between the patient and the doctor, which causes ineffective healthcare to be serviced. Secondly, cultural differences causes the patients to have different expectations out of the healthcare service. Patients coming from other countries or have a different cultural background can have unrealistic or wrong expectations of the healthcare system, causing them to feel discriminated against, thus causing more dissatisfaction. Thirdly, there is a general distrust of healthcare systems by minority groups due to past incidents of racial discrimination, which causes longer incubation periods of diseases compared to other patients. This can cause issues such as higher mortality rates and more severe cases of the same illness compared to other patients. Fourthly, illnesses are more likely to happen within minority patient groups compared to other counterparts, which may be due to external factors such as poorer housing, unemployment, racism, and in other aspects of life, etc. Lastly, there's a dislike and general discrimination when minorities are seen and approached in healthcare services by doctors, nurses, and even hospital receptionists. The 3 regions this project will explore are the Far East, the Middle East, and the West. The West shares similar cultures, social norms which are not only native to Europe but also exported to North America and Oceania, where strong political, social, and economic ties are present. They are linked by common understanding and languages coming from ancient Greece and the Roman Empire. Results from a 2007 general practitioner patient survey in the UK showed that Black and Asian minorities are 5 to 10% less satisfied with their healthcare. Regions serving over 10,000 patients have higher dissatisfaction rates than those servicing fewer than 4,000, which shows that as quantity of healthcare rises, its quality decreases, which causes higher rates of racial discrimination either purposely or unintentionally. This shows that Black minorities and Asians are targeted in the racism happening in the healthcare system. Larger cities have existing systems to help with translations for those who require, whereas smaller places such as in minor towns do not have the funding and human resources for that. Ironically, it is the smaller and less wealthy parts of the nations that have higher concentration of Black minorities and are more in need of translation services than those in wealthier regions. According to the Commonwealth Fund organization, African American women are 22% more likely to die from a heart disease, 71% more likely to perish from cervical cancer, and 243% more likely to die from pregnancy-related causes than white women. This shows a huge disparity between two different races in America. Some medical experts have argued that African Americans are more likely to be ill not because of their genes, but because of how healthcare professionals treat them. The Far East are those countries in the East and Southeast Asia. The countries in this region are linked together strongly by languages and cultures, as they are all mostly derived from China. Cultures in the Far East are more complex but linked together throughout history, with religions such as Hinduism, Buddhism playing an important role in it. There are health beliefs in these nations, with herbal remedies and acupuncture as a means of treating illnesses. The racism in this region is generally targeted at foreigners due to traditional defensive thoughts against outsiders still lingering around to this day. There is also discrimination within this discrimination against foreigners in healthcare delivery systems. White foreigners are more likely to receive earlier and higher quality treatments with better medical staff attitudes compared to the other fellow Asian foreigners, followed by black foreigners at the percentage shown below. 13% of white foreigners say that they are discriminated against in healthcare delivery systems, which is a much lower number compared to Asian foreigners at 22% and black foreigners at a whopping 38%. African migrants living in China are racially discriminated against in their healthcare delivery system. This is thought to be due to the minimal contact of the average Chinese person with African people and the color of African people's skin. The Chinese government has done reforms on their healthcare systems to better protect migrants such as the Africans, but it has failed to deliver. Doctors and nurses are not trained to prepare themselves to deal with culturally different people outside of China, which can cause confusion and misunderstanding between foreign patients and Chinese healthcare professionals. Language barriers between the Chinese doctors and African migrants can cause difficulties in giving and receiving treatment for the patients. The Middle East is the region including countries in South and West Asia. This region is mainly dominated by the Islamic faith, along with some small number of Jews and Christians. The population in these Middle Eastern nations are generally quite small, especially when many of them are foreign immigrants from places such as India or Pakistan. Qatar's population, for example, is 88% foreign. These foreign workers are mostly racially discriminated against across the healthcare system of Qatar. According to the WHO, religion plays an important role in health in Arab countries. Although the boundaries between religion and other socio-cultural factors are not easily discernible, health as a mirror of society is influenced a lot by religion. Many Qatari employers intentionally don't let their foreign workers know and be aware about healthcare packages and insurance so their company can save costs. As a matter of culture, Qataris do not want the foreign workers to benefit from their free healthcare, as they see it as a privilege only the rich Qatari may have. These foreign workers are also more in need of healthcare due to their lack of housing, horrible working conditions, and very low living standards, as they are more likely to get sick than the average Qatari in the same city. Foreign workers coming from South Asia don't usually follow the Islamic faith, including ways of life and belief, which could cause exclusions to their differences in religion. In Jordan, thousands of foreign workers have had their nationalities withdrawn, which threatens to take away their free healthcare privileges, which can be very bad since most of the population cannot afford healthcare there without government endorsements. After all this racial discrimination, some consequences that can follow, which includes high mortality rates for both mothers and babies during birth-giving process, higher mortality rates for cancer, as the importance of early detection of cancer is undermined when healthcare professionals take minority people for granted. There may be further distrust in the healthcare system, causing more minority patients to not visit medical centers for help and treatments. maybe bad mistakes within the vaccination process for minority people, causing extra health problems on top of what they have. So, what can be done? Governments can regulate and put laws in place to help fight and prevent racial discrimination. Educators should be teaching students about how racism is a big no-no in all aspects of life, not just healthcare. Healthcare professionals should be held accountable for racist actions against any patients. Hospital schemes should be set up to provide the best access to healthcare to all individuals from any race or ethnicity. Rebuild trust between all patients and the medical professionals and make sure that that is maintained. And finally, each and everyone must behave and be aware of racial discrimination. Everyone must do their best to prevent and limit all types of discrimination in healthcare delivery systems, specifically, and any other discrimination in all other aspects of life. We hope that this video has raised your awareness on how racial discrimination can affect healthcare delivery systems. Do us a small favor by filling out the form attached below in the description. Please like and share this video to assist us on our mission of raising awareness of as many people as possible. Thank you for watching our video.